And I think we're live. Let's just take a quick look and see.
Yeah, we got a lot of attendees in right now.
Yeah, folks are coming in. We're going to give everybody a minute to get in and get situated. Make a couple of quick housekeeping announcements while we're doing that. First of all, if you're having any problem with the broadcast, then the best thing to do is refresh your window in your browser where you're looking at this. That's the little circle arrow icon. That'll usually fix whatever problems you may be having. Secondly, if you want to ask a question, there's a little chat window over there on your screen, and you can type your question in there, and you can choose whether it's a question or a comment. There's a little sentence bubble, and you can change where you type in the sentence. You can change that from a chat to a QA bubble, which means it's a question. And we'll be looking for those questions. We'll be answering them live today. And so, meanwhile, hop in, say hello, tell us where you're from, and we'll give everybody just a minute to get situated before we go live to Kimberly, who is standing by and very excited. You can tell by that grin and the red outfit, right?
That's right. I didn't wear my red cowgirl boots, but I did wear red lace.
Hey, close enough. We'll take what we can get. All right, we've got a few more.
We have people from all over the world. Are you recognizing this? We've got Denmark and Africa and Bolivia. We even have a Canuck on here.
We even have West Virginia. Look at this. Yeah, this is great.
Denmark.
Good turnout today, Kimberly. I think folks are really interested in what you have to say. I'm not sure what you said differently, but boy, this brought them coming in, didn't it?
Pretty exciting.
Hey, there's even someone from Boise.
There. Oh.
All right, well, why don't we get things going? It looks like folks are getting themselves situated. I am pleased to welcome everybody today. I'm Dr. Adrian Larson with Miridia Technology, and today I get the special role in this webinar of introducing Kimberly and turning the whole thing over to her, which I'm excited about because I know what she's going to present. I've been watching her prepare. So here's the introduction I want to give today. What you need to know about Kimberly is that she never sits still. Anybody who's read her blog or followed her on social media knows that there's always something new. Like shoes, for example. I think it's best summarized by the fact that she's always getting new shoes, always changing things up. Well, it's the same in practice. She takes what works and she incorporates that, but she's never satisfied to just sit still. She always wants to get better, always wants to add new things. And so I've kind of gotten used to Kimberly coming into my office and saying, hey, look what I got. You got to check this thing out. I was over somewhere and I ran across this product, or I'm going to start trying this. And I'm always, okay, great, try it out. Tell me if it's any good. And she does. So today, she's going to share some things that she's been working on over the last few months that she hasn't talked about publicly at all. Some things that are new. Some of this will be what she presented a couple weeks ago in Baltimore at our symposium. And I know the quality of what she's about to present. I've seen her preparing and putting it together. I'm very excited. So a warm welcome to Kimberly, and here you go. Let's hear it.
Thank you, Dr. Larson. I'm excited to present some really awesome information. I am one of the lucky acupuncturists in the world who I get to treat in my clinic, but then I also get to study and research and on my days when I'm not in the clinic. So it's about as full-time acupuncture as you can get, even though I only treat in my clinic 2 days a week. I get to take the things that I learn in my clinic, bring it back and share with you. And then I get to learn new technology and take it back and share with my patients. So it really is a win-win situation. Okay, I am going to get started, and I hope that you will post questions along the way. I'll have stopping points where I will stop and answer questions. So if something comes to mind that you are wanting more information about, by all means, post it, and someone in our group will make sure it's that I see it, and we'll move from there. So with that, let me bring my presentation up. I want to also give a big thumbs up to Shireen. Shireen is newer in our clinic or in our research here at Miridia Technology, and she does an amazing job on our presentations, and she's cleaned me up pretty good. I create it and then I hand it to her and I ask her to make it beautiful, and then so that's what you get to see right now. So let me change over here.
Do you want me to put your poll up yet, Kimberly?
Not quite yet.
Let me know.
The nutshell of what you're going to get out of this webinar. We're going to talk about pain and why acupuncturists should be a pain specialist. We're going to talk about a little of the history with me and treating pain. I've been treating pain for more than 20 years now on patients. And then I'm going to teach you a technique that I have developed based on my studies. And I'm going to share that with you on a technique that I use that treats pain. We're going to talk about pain in relation to qi and blood stagnation in Chinese medicine. And then I'm going to share a clinical experiment that I did this in the last several months, and a new tool that I'm using in my toolbox in the clinic, which is fantastic for pain. So having said that, let me move on. So I am a firm believer that if you are an acupuncturist, you need to be really good at treating pain. And so now is a good time to go ahead and put that poll up. I'm curious. I can speak from my own experience and many other practitioners who I talk to all the time. I'm guessing that at least 50% of my patients, if not more, come to my clinic specifically for pain. And so we've got a poll, and in that poll, I want to know kind of the percentage of how much pain you are treating in your clinic. And I'm guessing a lot, because this is one of our bigger webinars. A huge number of you signed up to learn more about treating pain. So obviously it's an important issue in the clinic. So is that poll up now? Let's see.
Yes, the poll is up and the results are flying in. And it looks like right now the winner is 50 to 75% of the patients that are coming in are complaining their pain is a chief complaint. And then the next highest is 75 to 90%. So, yeah, a lot of pain out there.
So I'm right. Treating pain is a big, huge issue. So let's move on. If the number one chief complaint is pain, then we have to recognize that as acupuncturists, all the things that we learned in school and we graduate college, we have to be really good at treating pain. I've recognized in my progress in time, I run a clinic that I obviously treat a chief complaint. I take people through a series of visits as I'm treating them. Even if their chief complaint is not pain, I always find pain in their body based on acupuncture channels. And then I also have a clinic that is loaded with wellness patients who come to me once a month for their wellness care. And a lot of the time, the thing that I need to do is sort of fine tune their body, find where blockages are. And there's always pain in relation to that. And so all conditions lead to pain eventually. And that is because all acupuncture channels, we have a superficial pathway, we have a musculoskeletal pathway, we have an internal pathway, and we have an emotional pathway. So if you have emotions that are out of balance, that channel is going to be out of balance, which leads to pain. If you have digestive disorders, that channel is going to be out of balance, which leads to pain. So pain in Chinese medicine, in TCM terms, we call it qi and blood stagnation. If there's no free flow, if there is free flow in the channel, then there is no pain. And so whatever pattern that you're dealing with, whether it's qi deficiency or damp or B syndrome or liver yang rising, it always comes back to the flow of energy in the channel. And so chi and blood stagnation is a huge thought process in everything that we are doing in the acupuncture clinic. So let's look at chi and blood stagnation from a couple of different perspectives. There's acute chi and blood stagnation. This tends to be more at the superficial level. At the skin surface, a little bit deeper into the muscular area. If it's acute, it's easier to fix. So imagine that your patient comes in and they give you a call and they said, yeah, I moved wrong yesterday, or I slept wrong and now my neck isn't doing so well. I can hardly turn my neck. Those patients are easy to treat. We can treat them quickly and effectively, 1 or 2 visits, and the problem is resolved. It's the chronic blood stagnation, chi and blood stagnation, that becomes an issue. It goes deep. It's harder to fix. These are the stubborn cases. Although I will say with acute blood stagnation, it's almost always related to an underlying deeper condition that needs to be resolved as well. So you have to look at the whole picture. And so acute versus chronic, there's still a root treatment and a branch treatment, and it involves the whole muscular channel. But as it progresses and it stays in the channel long term, it's harder to fix, it's stubborn. And this is where the real work comes into your clinic. It's real easy to treat a few points and deal with acute blood stagnation. But if you are going to be an amazing acupuncturist, you have to be good at treating the chronic blood stagnation. So I'm going to make a statement here, and there'll be a few people who could argue with me and say that it's not true, but let me back myself up. So truth, if you're not good at resolving pain, you will not be a successful acupuncturist. I have met a handful, and I literally mean a handful, like 5 or less practitioners in my lifetime who don't do anything in relation to pain. I mean, maybe they're insomnia, maybe they are working on smoking cessation, but I would even argue with those practitioners because every acupuncture channel that you're treating is in relation to pain. And I truly believe that you have to be really good at treating pain.
Kimberly, the results of the poll, over 90% of the people that responded have pain as the majority of their chief complaints. Exactly. So I think that says it right there.
And I came into this medicine for a pain-related condition. I had pain that I could not resolve. And at the time, I was a massage therapist, and I was very familiar with other modalities besides Western medicine. I also had a Western medicine background in that I had worked with, I had been a medical transcriptionist typing up workman's comp reports, which were all related to pain. So I knew the system of what you needed to go through if you were going the Western route. And I had sciatic nerve pain that was absolutely horrible. And I went the routes that I felt most comfortable with first. I had massage and I had chiropractic, and after about 15 chiropractic visits, and the pain was not resolving. And by this point I had gone the Western route, and I was doing the anti-inflammatories and the pain relievers and the muscle relaxants and the physical therapy, and nothing was resolving my problem. And it was acupuncture that actually resolved it. And it's because we come in at a deeper level, and we look at the body from an internal and an external perspective. So based on my experience over the years, being a massage therapist, working with workman's comp cases, and then moving into the acupuncture world, I really did learn to become a pain specialist. And I'm going to teach you some of the things that I have learned. There are 2 important elements if you're going to be a pain specialist. You have to have a good technique, and you have to have a good tool. The There are lots of different techniques out there. Most of you, once you graduated college, especially if you were TCM trained, you went on and learned a whole bunch of different acupuncture modalities, if you will, thought processes in order to relieve pain, because basic TCM wasn't enough. You might have went into sports medicine, you might have went into a balancing technique, a lot of different avenues. Whatever your avenue is for treating pain, you also have to have a lot of tools, and tools that I have used over the years in my clinic. Obviously, I started out using my hands because I was a massage therapist, and I would manipulate and work with the acupuncture channels and work with muscles and tendons, ligaments, joints, pressure points. Then I became an acupuncturist. I began using needles and microcurrent, auriculotherapy, gua sha, cupping, moxa. There are lots and lots of tools that you can use in your clinic. So if you have a good technique and a good tool, that's the first, those are the first important elements that you need in becoming a specialist. So I'm going to give you a little history here. Are you ready for this picture of me from 2004? I've changed a lot since then. So here I am back in 2004. That's actually my logo, A Touch of Heaven, Acupressure and Massage Therapy. And I was, it was that mother of 8 at the time. We had 8 kids, and I had a massage clinic in my home. I had one room that I used for massage, and then I was a full-time acupuncture student. And I absolutely loved learning about acupuncture points and acupuncture channels and pathways. And when I would go back to my massage clinic, my massage patients were super excited to walk this journey with me as I was going through 4 years of college. And the truth of the matter is, I became better and better at massage therapy based on the things that I was learning at school to become an acupuncturist. And whatever I learned, I would take the notes and I would diagram them and I would tape them to the wall in my massage room, and the patient would be face down and I'd be looking at points and looking at pathways and discovering that these acupuncture channels would literally come to life when I was working with patients on the massage table. And at some point in time, you know, as I was learning about different types of acupuncture points, and I'd have a patient who had neck pain, and I was learning about entry exit points and Luo points. And I remember sitting and I had the patient, I'm going to come back to my face here. I feel like I need to. The patient would be lying on the table. My hands would be working on their neck. And I remember feeling stagnation in the neck. And I knew that this was the problem that the patient wanted to have relief. And as I was feeling, and I would be thinking, where does this acupuncture channel go? And I was thinking about the large intestine channel and how it would come through the neck, right through that area. And perhaps that was what I was studying that week. And then I recognized, oh, and so then the acupuncture channel goes right here. And then the large intestine channel ends here on the other side. And then it needs to go to the stomach channel, and then it goes down. So I'm imagining all this. So I'm feeling stagnation, and a light bulb goes on in my head. And I think to myself, well, if this is the large intestine channel and it has to come through the neck and it comes over and they've told me where their pain is, if I were to open up the exit point on the channel and I could push on this point, what would happen? It would be like opening a door. And so as I would play on experimenting with massage, I would open it up and then I'd come back and I would feel the neck and the pain would just resolve. And it was fascinating to me to just feel stagnation melt away like butter, because I wasn't just going in and digging into an area where they had pain and massage and rub and push and pull. All of a sudden I was using the power of the acupuncture channel, and major shifts began to happen. So as time went on, I continued to learn about these fascinating acupuncture points. And I learned that the Luo point, if there was a problem in the lung channel and the large intestine channel, if I worked the luo point of either channel, it sort of balanced things back together between the two channels. And so I had learned entry exit points, I had learned luo points, and I had learned that by working with acupuncture channels, I could help push energy from one channel to the next, which would then resolve stagnation in the tendinomuscular channels. So I'm going to jump back here and talk about tendinomuscular pathways. So obviously, as I'm learning about, all of a sudden the work that I was doing on the massage table would become so much easier. So the next wow experience for me was learning about musculo-tendinous pathways. So all of a sudden that large intestine channel, which I just talked to you about, and I recognized there was an exit point and based on where the channel went, well, then I learned about the tendinomuscular channels and that they had a bigger range, a much wider area of where the patient could feel pain. And so as I learned that this large intestine channel affected and wrapped all around the scapula, the large intestine channel became really a big deal to me, because I knew that if I did work while I was massaging along that large intestine channel, that I could resolve stagnation in the shoulder and in the neck and in the temples for where the patient was feeling pain. And I don't know that anyone in my teaching theory taught me. Don Snow, he was an instructor at PCOM, and he had a great fascination with the tendinomuscular, tendinomuscular, same thing. But he had a great fascination of how to be more effective in resolving pain using the tendinomuscular channels. And if you will look at any of the pictures where the muscular channels are shown, if you'll notice the areas that are dark along the channel, those are areas where chi accumulates at a deeper level. And when you're working that tendinomuscular channel, if you will work those areas that are dark, it's actually where there's more fascia tissue. And so you're using the power of fascia and electricity within the body as you're creating movement in that channel. So I had never recognized that before in any of the books. You just saw a picture. Here's the tendinomuscular channel. But a key tidbit that you can take away from this lecture today is when you're looking at those pictures of the muscular channels and you're wanting to work and palpate or use whatever tool that you're using to move chi in the channel, if you will put extra attention at those areas where the black is on the picture, there's more power in the channel at those areas. And large intestine 10, large intestine 11 is a big name brand, if you will, acupuncture point that's used in so many combinations. But large intestine 10 and 12 are big areas where the chi accumulates. And if you're working with tendinomuscular stuff, if you'll work those points, you will get a lot more power in what you're doing. So a basic theory for utilizing the musculotendinous channels is, if you're using needles or whatever modality, however you're going to treat the channel to move chi and blood in the channel. So I'll just talk needles at this point. When I was in college, actually, I wasn't allowed to use needles, so I would use pressure points. And if you will start working up that channel from a distal area, I typically, if I was on the large intestine channel, I'd start somewhere around large intestine 4 and palpating and working my way up and get to large intestine 10, large intestine 11. You'll have a huge impact of creating movement in that channel. So I think I've talked what I want to about this one in particularly. If you will use the, let's see, let me go back for a second. So you're going to understand the value of one little point, and you're going to understand the power of the musculotendinous channel pathways and how to use them more effectively. The next thing that you want to recognize is the flow of energy from channel to channel. So notice here, the kidney channel. Oh, that's what we want to focus here on, is recognizing the differences in the channel. So practice looking at the acupuncture channel and knowing the unique differences muscularly. So here's the kidney channel. If you just looked at the kidney channel in general, you obviously have to know where all of those acupuncture points are and how to utilize them. But if you recognize that that kidney channel has a huge impact on obviously the muscular area up the inner leg, which kind of makes sense because that's where the acupuncture channel goes. But don't ever forget the power of the muscular area in the spine. So when you're treating that kidney channel, recognize that you're making a huge impact on the spine. And another interesting one, I think, is the spleen channel. So the spleen channel comes up the inner leg and goes up into the chest. But muscularly, if you're working on pain in that lower abdomen from the umbilicus on down, if you're looking at pain that comes through the groin, the spleen channel is really effective. But then recognize how it comes through that rib area and hits the mid-spine. If I was just thinking acupuncture channels instead of muscular, and somebody had rib side pain, I would mostly be thinking of the gallbladder channel, but there's huge power in knowing and understanding the acupuncture channels. Let's see. So what you want to recognize is that if you understand the value of those little tiny acupuncture points and what they do, studying the dynamics of the points, whether it's a luo point or an exit point or even a chi cleft point, because a chi cleft makes bigger movement of chi in a channel. That's why acupuncture, when you start digging apart the little bits and pieces about an acupuncture point and how it works, keep that in mind when you're dealing with tendinomuscular, and then utilize the power of the tendinomuscular channels, because that is where you're going to get a huge shift. And if you have forgotten that the large intestine channel actually wraps around the whole scapula, then you're going to miss the opportunity to work that large intestine channel in order to resolve pain. So here is a simple analysis what I do. When someone comes to me for pain-related conditions, I find the musculotendinal channel where the pain is. I've listed them each here in this picture. If you are an Acugraph owner, inside your Acugraph, you can just click on the acupuncture channel and the musculotendinal channel pathway will come up. And it's a great way to recognize somebody might have internal imbalances, but you can recognize where some of their pain might be and how it's connected. So the next thing that I do is I treat distally on the channel, pay attention to the areas that are dark and work my way up. I might treat distally and then to the trunk of the body if I don't necessarily do a whole lot. Unless the gallbladder channel, I think there's some of the darker areas where chi accumulates if there is tension in the head. So know your musculotendinal channels, treat distally first, pay attention to the dark areas as you're working up, give more attention in that area. And this is a universal thought process. If you're using microcurrent, if you're using needles, if you're using manipulation with your hands and fingers, palpating the channel, if you're using gua sha, if you're using cupping, all of these techniques work. Then the next thing that I do is you treat the next channel in the energetic flow. There's huge power in this. Acupuncture pathways run from one channel to the next. So here's an example. I'm treating the gallbladder channel. I know the muscular area. I know the area of pain, the patient's pain, maybe they have pain in the glutes, and I palpate in the glutes and they have a lot of pain. I can actually treat the musculotendinal pathway and pay attention to the areas that are dark as I'm working my way up. And then I move to the next channel and I treat a point or two on the next channel. And it's like opening the floodgates so that all of that chi and blood stagnation, that congestion that's happening in the painful channel opens up. And it's fascinating. It is fascinating if you were palpating the patient. I'm not sure if you can see my arrow, but let's say you've got the patient face down, you're palpating the glutes and everything is painful. You'll follow this technique, you'll treat the channel, the muscular channel, then you'll go and you'll treat another point on the next channel, which would be the liver channel. And then you go back and palpate and the patient is like, wow, you are magical. What did you just do? That feels so much better. It's such a simple technique and it works. I'm getting close to answering some questions. I'm going to give you a couple of examples. So here's shoulder pain and how I might think of it. And when I say that you don't have to just choose one muscular pathway, oftentimes I'm choosing two. So in this example, I have two muscular pathways that I am talking about. I've got the large intestine. Patient has shoulder pain. I'm palpating the large intestine channel because I know the large intestine channel, the musculature goes all the way back into the scapula and through the shoulder and into the neck. So there's a lot of range that I can cover there. So I'm treating and palpating and treating on the muscular channel. And then the next channel that I'm looking at is the urinary bladder channel because that's that inner scapula area and along the spine and more shoulder stuff. Then I'm treating some points on the next channel. So here in this one, if I was doing the large intestine channel, the next flow in the channel would be the stomach. And that is the one right here below it. And then the next channel in the flow for the urinary bladder channel would be the kidney channel. So it's just simply a needle or two in the next channel, or sometimes even a tag, whatever your device is. If I'm using microcurrent, if I'm doing laser, if I'm using tax, if I'm using palpation of my hands, this is the flow of what I'm doing. One more example, and then I'll stop for questions. Patient has mid-back pain. So the muscular channels that I might be looking at would be, let's see, I chose the urinary bladder channel because the musculature that comes right down the spine all the way through. And then I went ahead and I threw in that spleen channel because I think a lot of people forget about the muscular pathway of the spleen channel. It could also be kidney channel. You have to palpate and pick which musculotendinal channel. So to be clear here, you're not clicking just the exact channel points. You're palpating the muscular channel when you're making this decision. So after I have done that and I have treated distally along the channel, then I choose a couple of points on the next channel in the flow. So the next channel after the urinary bladder channel is the kidney, and the next channel after the spleen channel is the heart. So that is in a nutshell, and I'm going to stop for some questions here. If I can get my mouse, there we go. Oh, looks like I've got a couple of questions here. Would you say the trigger points are areas of stagnation? Absolutely. When I was a massage therapist, before I learned the power of acupuncture points and acupuncture channels, trigger point therapy was a technique that I used. But again, trigger point therapy was one avenue that I thought of before I was an acupuncturist. Once I became an acupuncturist, the power of the acupuncture channel, I feel like, is even more conducive to successful treatment. Let's see. Next one. Downloads, yes, I guess we answered that. So if the patient has scapular pain, what treatment protocol would you suggest? So if the patient has scapula pain, I just gave the example of that. You could look at the small intestine channel, and that's a good channel to look at. The large intestine channel I really like because it's almost one that I always use because it envelops all of the scapular area. And so you could look at the small intestine channel, you could look at the large intestine channel, you could look at the urinary bladder channel. Those are all tendinomuscular channels that go through that area. I highly suggest that you get really good at knowing your muscular pathways. In your handout, you could print out the one page. I actually have them in the downloadable handout, a full page of showing you what those muscular channels are. And in your AccuGraph, just get really good at clicking and recognizing and just have them come to mind quickly for you. What points are chosen on the next channel? I believe that I talk about that. Let me just take a look at my notes here real quick. I don't have those listed in my notes in this presentation, but in the handout that I've given you, I've listed some of my favorites. Oftentimes it will depend on if my patient is face down or face up and what device I'm using in order to treat the next channel. But sometimes I'm feeling for congestion in the next channel, and I will treat the area of congestion. Specifically, she cleft are really good points, but a lot of what you can do is based on palpation. And in the PDF handout, I've listed some of my favorites of what I use and how I choose them. Let's see. So treat the channel with the pain from the distal points to proximal, then treat the next channel in the flow, but the flow typically goes the opposite direction in the next channel. So when treating the next channel, do we still treat from distal proximal or do we go proximal to distal? I don't think it matters. I think really what you're doing is you're creating movement in the next channel. So if you've got large intestine channel and you're trying to, everything is stuck in this large intestine channel and you create flow in the stomach channel afterwards, there's just a natural pull that's going to happen in creating movement. I find the most dynamic, if you want to experiment and play with this, do the gallbladder channel. Recognize in some of my distal points, if I'm treating the gallbladder channel, I'll go down to gallbladder 41, 42, or 43 based on what's tender to the patient, and I'll begin treating there. I might treat gallbladder 34, I'll treat some hip points, treat into the glutes, I might treat gallbladder 21, and this is on the muscular channel. Then to make that muscular channel really have a swift flow so that energy will move into the next channel, the liver is the next one in the flow. So the liver luo point is fantastic because it pulls energy into the next channel, especially if the liver channel is deficient and the gallbladder channel is excess. It's a secret passageway that pulls energy to the next channel. But I might do liver 8. I'll palpate and see, but almost always the luo point on the liver channel is tender, and the patients they'll say things like, wow, how did you find that? I'm like, oh, just got magic fingers, and I'll palpate it, I'll needle it, and then I'll go back and palpate at the glutes where their pain was, and it just resolves by half. It's really, really powerful. Okay, I need to get on to some more of these questions and not go over time here. Recommendations for cervical spine pain due to disc herniations. Cervical spine pain, if you'll look at the tendinomuscular channel, the tendinomuscular channel is the kidney channel, and that is huge in relation to muscular in the cervical spine. Please clarify what you mean by the next channel. If you're an AccuGraph user, if you go to the energetic flow, it's the next channel. So if you started with the first channel, it goes from lung, then it goes from lung, and then it goes to large intestine, and then it goes to stomach, and then after stomach goes down, then spleen comes up. So that is what I mean by energetic flow. know the flow of energy from channel to channel. And I actually have a diagram of that I will show you in the slide presentation. And I've also given you a diagram in your handout. Where do I go to review this video? This video will be given to you afterwards so that you can watch it. Do I use ion pumping cords? Not for this technique. You could, if you would graph the patient, that ion pumping cord is a whole nother discussion. That is a technique that you could use, but it is not my typical technique. Where are the handouts? The handouts are, there's a download for the handouts, and we're going to put that up in a link in a few minutes. I think Dr. Larson answered that. Do you check for pulses to choose which channel is more susceptible for treatment? For this technique, this is a branch treatment technique. This is specifically for pain. By this point, I've already done a basic balancing based on accugraph or pulse diagnosis or whatever it is that I'm using. So I do not use pulses for this technique. I literally am using tendinomuscular pathways and the next channel in the flow. Would muscular work with migraines? Absolutely. Think of where the tension is for the migraine. If the migraine is urinary bladder muscular in nature, or triple energizer muscular in nature, start looking at those pathways. If it was migraine, I might explore a little bit deeper and look at internal pathways and make sure that the internal pathways and muscular worked as well. You can't have a migraine without muscular tension. So if I was treating migraines, my root treatment would be dealing with the internal pathways, but I would definitely be feeling for the tendinomuscular, because you've got to resolve the stagnation in the tendinomuscular pathways in order to be really effective at treating the internal as well. Any chance to indicate where the notes are again? Dr. Larson, would you like to chime in here for a moment?
We'll be putting up a link in a few minutes when we get to the point that you want me to put it up. So
okay.
Carry on.
So I also would like to tell you that we'll get people who will say, oh, I watched the webinar, and how do I find the notes? When you go into your webinar portal, if you are an Accugraph 5 user, the webinar will be there for the future. And there will be a link where you can click that says, watch this webinar. And right below that link where it says, watch this webinar, there will be a link that says, download the notes. So the PDF download will be there for Accugraph 5 users. If you're not an Accugraph 5 user, further in the webinar, we will have a link that you can click where you could download the notes. So I'm going to move on. And do you have any questions for me, Adrian?
No, carry on. You're doing great.
Okay. I'm going to go to my keynote. Right, so here we are 13 years later. That was back in 2005, and here we are in 2017. So I turned 50 this year, and I had this really new goal for my life in general, and I wanted to focus the next 50 years of my life on working smarter instead of harder. So that's me on my 50th birthday. And of course, we have to throw a shoe picture in there because that's just who I am, red shoes. So I was at an acupuncture convention, Pacific Symposium, and I met this guy, and he had a vibrational tool. Now, when I'm at Symposium, I am running around like crazy, and I don't have a lot of time, and our booth is super busy. But I made a mental note, I grabbed his card, and I decided that I needed to meet this guy and learn more about this vibrational tool. I have many different tools that I use in my clinic, but this is one that I decided that I needed to learn a little more about. So I talked to the guy. I said, I need to try this tool. And I tried it. He used it on me. I found someone local in my community who was using the tool. I had them use it on me. I liked it. I decided that I wanted to do some experimentation with my patients. They loved it. And I recognized that this tool was amazing for treating chronic pain related conditions. Here's the deal. The way that other people were using this tool is they were just going to the area of pain, treating the area of pain, and finding that they were getting fantastic results in using this tool. But when I used it, I decided to use it like an acupuncturist. I couldn't go against my theory of acupuncture channels and pathways and the power of the acupuncture channel and pathway. So I began using it like an acupuncturist. And I have to say, hands down, I was getting amazing results for chi and blood stagnation related conditions when I used it like an acupuncturist. There's another guy in the clinic that I work in who started using it as well. And he was using it just very superficial in nature, find the area of pain, treat it. And he was like, yeah, it works really good. Patients feel like they get better. But when you add the power of the acupuncture channel and the acupuncture pathway and the theories behind acupuncture, I'm telling you, it quadrupled the effect from what I was doing to what anyone else was doing. So I went to Dr. Larson and I said, we have to share this tool. And I told him that I was going to write a book. And I think they kind of laughed when I said I was going to write a book because I haven't written a book before. But lo and behold, I have been researching, experimenting, putting the theory into practice. This is something that I've been wanting to teach. I always thought it would be fabulous to teach massage therapists how to be better at what they did if they use the power of the acupuncture channel. And then I wanted to teach acupuncturists how to be better at treating pain if they use the power of the musculotendon channel and palpation and incorporating acupuncture as well. So I feel like I could wear two hats and I could go back and forth. And so I wrote this book with the very specific on how to move blood and stop pain using the power of the acupuncture channel. In the book, I go behind some science behind vibrational therapy, why it makes sense for chi and blood stagnation, and I teach you how to use it like an acupuncturist. So based on the research that I did in using this tool, I have a final analysis, and there are three major big things that I learned in this process. So I'm going to talk about one. First one is adding this modality before acupuncture treatment seems to bring better results than a standalone acupuncture treatment. So in order to explain this, I'm going to tell you about an informal clinical experiment that I did. And when I say informal, I didn't, this isn't published as a formal clinical research project, but in my own clinic, this is what happened, because I did have to go back to Dr. Larson and explain why it was important that we add this item to our repertoire and how it could be effective with acupuncturists and acugraph users and the people who are wanting modern science to be able to use in their clinic. So here's the clinical experimentation that I did. For 3 months, first of all, I had an idea, and my thought process was, if I could, let me go back before I do this. If I could move chi and blood in the acupuncture channels before I began treatment, my thought process was that I could get better results. And if I could use vibrational therapy as my mode of treatment, how could I how could I get better results all the way around? So I came up with a treatment protocol, and it was based on having the patient lie face down and treating all of the back shu points first. And because by treating all the back shu points, I'm actually stimulating every acupuncture pathway in the body by treating the back shu points. So here's how it went. Before each treatment, I treated the back shu points. I also did SI 11 and gallbladder 21 because almost everyone has some type of shoulder tension. I treated across the lower back band because so many patients have issues of sitting too long and DIMI issues. So I added gallbladder 29, gallbladder 30. And then I did the lower leg of the UB channel in the calf. And while I was down working that area, I added gallbladder 34 because it's a good moving point. Bladder 58 because it is the great luo of the back. It affects all of the back shu points on the back. So I figured it was a nice extra addition to the treatment. And then I did spleen 9 because so many people tend to be spleen damp, and I wanted to give an extra push of moving energy back up. As everything came down, I wanted to give a nice push of moving energy back up the acupuncture channels on the inner leg. So this whole treatment protocol took me about 5 to 7 minutes. So this is the results that happened over a 3-month period. In that time, I did about 180 treatments. That's not 180 patients, but that's 180 treatments. Lots of my patients were coming in multiple times. Most patients received the therapy multiple times. I found that problems that used to take me 6 weeks to normally resolve were getting better in 4 weeks. I found that patients who were my monthly patients, if they had come in multiple months within the 3-month period, by the time they reached their 3rd month, that their normal chief complaints were less than what they were previous. I found that patients who, if they were liver qi stagnant type of patients, and if you were going to put a needle in, that every point would hurt typically, and you had to be extra careful with those types of patients on certain times when they were really stagnant, that if I did this treatment first, that they were not experiencing the same amount of pain with needling. And I have a lot of non-needle patients, and absolutely, hands down, those patients got better results if I added this treatment into their protocol. And I also learned that long-term patients with chronic shoulder pain conditions did better if I added this treatment with my typical treatment than when I was treating acupuncture alone. So this turned out to be pretty phenomenal. Then the patient's response, the patients loved it. I mean, it was fabulous. They absolutely, Kimberly, please don't get rid of this tool. We love this tool. It's relaxing. It felt good. It was really good. I found that wellness patients who had general pain, when they're coming in for their monthly tune-up, I always find out where their general pain is, and I give them a full body tune-up, that those patients absolutely loved doing the rapid release, and that when they came in the next time, their general pains were not as significant. And these are patients that I've been treating for years, so I had a really good way to analyze that. And then I also found patients who were heavy, phlegm, damp, congested. Those are the patients where when you touch their skin, you can just tell that she is not moving, and they tend to have heavy, damp B syndrome types of conditions, fibromyalgia, just general aches and pains, depression, sluggishness. And that if I did that protocol that I just explained with them, they got much better results when I then put acupuncture needles in them, because it was jump starting the system. So I'm going to move on to the second point. I learned that rapid release therapy is an effective way to move qi in the acupuncture meridians without needles. So many of you know, I already use laser in my clinic. I use microcurrent, I use auriculotherapy, and I've established myself as a specialist in my community for non-needle acupuncture techniques. And the way that I have to judge whatever it is that I do, because my job title here at Miridia Technology is Acupuncture Research Analyst, I can't bring a tool to you and talk to you about it unless it has the power to change the graph. And so I did some experimentation with the rapid release. I would graph the patient. I would treat the recommended points based on the graph. And I think in this experiment, I used source points. So I graphed the patient, I did the source point exam, I graphed the patients, I treated the source points just for simplicity, 15 to 20 seconds per point. And then I would come back and that's all, not any other, that's the only treatment that I would give them. No musculotendon stuff or anything else, just treating with the vibrational therapy, and then come back and regraph them 2 days later. And I 100% of the time, I got either an improved graph or most of the time, an improved graph. 100% of the time, an improved PI score. So I know that the vibrational therapy has the power to affect the acupuncture points to balancing the graph. So this wasn't the back shoe treatment that I talked about in point number 1. This was simply graph the patient, treat the imbalances shown in the graph, and I chose to use the source points to treat, and then come back 2 days later. And then I have one more point, and then we'll move on to questions. So the third thing was that rapid release makes treating pain-related conditions a whole lot easier. The protocol that I showed you early on, as far as basic pain using the musculotendinous channel and the next channel in the process, that would be the start of what I would do for treating chronic pain conditions. And then I would, after the effect, go in and just treat the area where the pain was. So break up the stagnation at the shoulder joint or in the low back, and just really go in on a deeper level. And sort of like if I was going to do some massage afterwards or some manipulation afterwards, it made treating these types of conditions a whole lot easier. So really, my goal of learning to work smarter instead of harder. So many of us in the healing world, we put our whole hearts, we put everything we've got. Sorry, I'm trying to bring my face back here. And my mouse won't let me. We put everything. It can be hard on us in later years. I know so many massage therapists who start out their years and they put everything in and they're all gung-ho, and then they quit doing what they're doing, even though they're good therapists, because they lose the power in their hands and they develop more problems in themselves. And as an acupuncturist, we're always looking for that next tool, that next device, whether, becoming really good with microcurrent. A lot of times we have to go in and do massage and manipulation. And that was my story at that point. I do a lot of extra massage, and that's probably why I'm so good at treating pain, because I use my hands a lot. But this has changed everything. Patients are getting better much faster. I'm seeing fantastic results, and it's been really phenomenal. So,
do I put the notes up, Kimberly?
Yes.
And then you have a video to show?
I do have a video to show. Do I have any more questions that I need over here? So we're going to talk about the, we're going to give you the download for the handout. And so I have a video. This video is actually from our symposium, and you might recognize a famous person that I'm treating here.
You want me to start it?
Show the video.
I'll show it.
And then I'll
a couple of back shoe points that are kind of nice to recognize. So the SI and the urinary, the back shoe for the SI and the UB are right here at the sacrum. And so I tend to put extra attention in those because people just don't have low back pain or hip pain without it somehow affecting tendinomuscularly in the top areas. So I'm just gonna start. I told you that I do the back shoe and I do across the hips and into the glutes. So it doesn't quite matter which direction. I tend to start here. And I don't have to be point specific. Like I don't have to, I'm just working up the channel, and so I am affecting all of these points when I'm doing this protocol. Can you guys still hear me talk?
Okay.
All right, so I'm gonna go up and down the back. Sometimes I am feeling, I'm going to have to answer your questions after, okay? Sometimes I'm feeling with my hands and I'm feeling where blockages are, and so similar to where I would. So I'm going to do SI11, and I'm going to do GB21. This one here, did I go too hard? It's the, that rubbery one will grasp more. And really, I'm not pushing. I am allowing the device to do the work for me. Jake, do you feel it deep?
I'm good. It's really just picking up people.
Do you feel it deep, though, inside in your organs and in your gut, and the vibration?
Don't know how to answer that.
All right, so I'm going to do across the lower back. I'm going to get into the glutes. You can use this this head right here, this green head, based on the vibrational frequency. It warms up, so it's also nice to, if they're having muscle spasms, the warmth of the device is nice. It doesn't warm up on purpose, but it just warms up based on the fact that it's vibrating. So I do gallbladder 29 and 30. And I'm usually just feeling for where that point is, just like you would feel if you were going to put a needle in. I don't find it really necessary to do all of this area as far as stimulating the channel. I go back to my theory of, let's see. I actually like to work through clothes or a sheet because it just slides nicely. But I can use flesh as well. So I'm doing the urinary bladder channel. I'm doing the muscular portion. I am focusing on the areas in the picture that are dark. I'm going to treat gallbladder 34, bladder 58, and I'm already feeling for spleen 9. You can see it just kind of goes. So that was my root treatment, right? So that was a root treatment, and at this point we've activated all of the acupuncture channels. We've created a flow of energy that's moving throughout the body, and my next step would be to focus on 1 or 2 channels where the pain is. So was it this side?
Yeah.
So he complained along the urinary bladder channel, and also the gallbladder channel. You know how the gallbladder channel comes up and does that that wrap of red here through the glutes when you're looking at the picture. So if I'm using the urinary bladder channel, then my next channel flow would be kidney. And if I'm using the gallbladder channel, then my next channel flow would be liver. So after I've already treated actually the gallbladder channel and the urinary bladder channel, but I didn't focus too much on the gallbladder channel during that treatment because I was just doing the root treatment. But if I touch down the side of the leg and I hit the gallbladder channel and I'm working up the side, you're getting into the sacrum and those points on the sacrum. If you use this rubbery tip, you can get in and get point specific. I'm tickling him a little bit here. Almost done, and then I'll be able to hear them better. All right. So then it's just a matter of what I've done so far up to this point. I've prepared the acupuncture channel that if I want to go now and work deeper in here, when energy moves down the gallbladder channel and up the liver channel, it has a place to go. When energy moves down the urinary bladder channel and then up the inner leg, it has a place to go. So at this point, I could go in deeper. That piriformis is kind of deep. And then the question, if he was a patient who needed to be a non-needle patient, I could use this as my entire treatment. But I use it to move chi and blood so that now if I stick a needle in, whatever needle treatment that I'm going to do is going to work twice as good as it did if I were just to put needles in, because we've already created a flow of chi and blood. And
and we are back. Kimberly, there you are. Hi. I'm not hearing you. Is your microphone on mute? There we go.
There we go.
Hey, that was a tremendous video. Thank you very much. Did anybody guess who she was treating?
I think somebody wrote, I think you called him Jake. That was Jake.
Yep. That was Jake Fratkin of acupuncture fame. So, Kimberly, the book you wrote, you wrote it, and I've read it. Heck, I edited it. I even wrote the foreword. It was a lot of fun. But you have chapters about some of the things you taught today. Your handout is actually condensed from part of your book, and that handout link is up. But you also have more in the book, and it includes the use of rapid release technology in acupuncture, which I think is really valuable. For those that are interested in the rapid release technology or in Kimberly's book, which we are making available for those that actually decide they want to use rapid release, I'll put up a link where you can find more information. If you buy the rapid release, you get Kimberly's book with it at no charge. And I will put up that link right now for those that want that. And then why don't you hit the last questions, and we need to be getting finished up.
Yes. Okay. So let's see. John asked, you referred to treating back shoe points. All of them, which ones? I do treat all of the back shoe points because my goal when I'm doing that is to put the entire body into balance. It's actually one way that I will balance the body. If you're coming in for tendinomuscular pain and I've graphed you, focusing on your shoulder, neck pain, back pain, I will treat all of the back shoe points and do that protocol as a way to balance the graph, believe it or not. I don't always balance the graph in that way, but it is one way that I do. So I'm treating all of the back shoe points, and they're very easy to find. Really, you're just palpating and you're feeling for the points down the spine. Rebecca asked, when you treated just the source points to balance the graph, do you mean you treated the source points using the new tool on the red and blue lines on the graph? Yes, that means that the graph was imbalanced. Let's say the lung channel was excess and the kidney channel was deficient and the spleen channel was split. I treated the source point of the lung channel, the source point of the kidney, the source point of the spleen. So whatever specific, I wasn't dealing with muscular channels. I was just simply using the point. In fact, now's a good time to show you. So when you're using the rapid release, this little head right here is, I would use it very specific on the acupuncture points. It's comfortable. If I was doing muscular pain, I would use, one of these other heads. So there are different ways that I use it, but if I was just using it to treat an acupuncture point, this is what I would use. If the patient is on Coumadin, is this tool contraindicated? It is not contraindicated. If I have a patient who is really, really weak and deficient, this is probably not the tool that I'm going to use. I
would add, Kimberly, anytime you have a patient on Coumadin, you're going to want to be very careful with body work due to the potential for bruising and internal bleeding. So I would recommend staying away from it, just out of an abundance of caution.
Right. It's not written in any of the paperwork on it, but yeah, I'm cautious with a patient of that nature anyway. Whoever M has been using it for 2 years and it's fine on the skull too, padded probe. Yeah, this probe right here, I know that when I first got it and I was exploring, I was cautious, but it is actually very comfortable on the occiput if you're trying to release occipital muscles. So I use this one's rubber, and I use it, and you're not going in and doing any hard work. That's the beauty of it. You are literally allowing the vibrational, the frequency of the device and the vibration to do the work. And so it's just a matter of touching the area. Willow says, seems that the rapid release is very loud. My acupuncture treatment room is right next to a massage therapy room. Would this tool be disruptive because of the noise? In my treatment rooms, I have a sound device. What is it called?
Like a white noise
A
generator?
white noise generator. And I haven't had anyone have any complaints about the device. In fact, I have one in each treatment room, and my massage therapist actually loves to use it. So I'm never using it for very long, and not had any problems with the sound. Oana says, I'm wondering, I have a 3.5-year-old little boy with cerebral palsy. He is hypertonic, and I work with him with lasers for releasing, as Nick, something as possible for that muscular tonus. Could I try this? So a lot of practitioners bought the rapid release when they, at our symposium, and I've been getting email after email after email. And what I'm hearing is that my kids love it. You'll want to be a little more gingerly on kids. And obviously, you don't need to treat as long. Kids channels move so beautifully. And so I've used it on my kids, and I wouldn't hesitate to use it on my grandkids. I wouldn't treat as long as I would on an adult who is filled with chi and blood stagnation. Is a massage therapist allowed to use this tool? I believe so. Massage therapy, I mean, it is a vibrational tool specific for pain relief. So I guess you'd have to check with your the statutes in your area, but I know many massage therapists who are using it. If I was a massage therapist, I would use it.
And the website, let's see, first of all, somebody mentioned that the handout link wasn't working. As you said before, these will be posted in the, if you're an AccuGraph user, then where we have the webinars posted, the handout will be posted there. When this webinar is posted, you'll be able to download it there. And then the other thing, if the link isn't working for the website for Rapid Release, it's rapidreleaseacupuncture.com. That's where you can learn about it from an acupuncture-based perspective. That's where Kimberly's book is available with it. So rapidreleaseacupuncture.com.
Okay. And for those who are not AccuGraph 5 users and they don't have a portal, how will they get their
well,
download?
I'm hoping that the link worked for everybody.
Okay.
If not, then just contact our office, shoot us an email.
Okay. Perfect. I hope you enjoyed it. It was really fun to gather all this information, to accumulate it all, and to watch my clinic. The exciting part is to watch changes that have happened in my clinic. My patients are always asking me, what new thing are you learning about now? And I'm always learning about new things, and I always get to test it based on AccuGraph and if it changes the channels. So I don't use a tool in my clinic. It has to be effective. My patients have to love it. It has to change the graph, and it has to be easy to use. I mean, how many things have you bought over the years that you stuck on a shelf because they're not easy to use? I mean, this fits every criteria of what I need in a clinic, and really loving it.
All right. Excellent job, Kimberly. Thank you very much. I loved all the tips. I loved the valuable clinical stuff of how you can use the channels, how you can use the next channel, and the whole idea of moving chi and blood. I'll tell you, the Rapid Release tool is amazing. And so if that strikes your interest, check that out as well. And we will be signing off until next month. Thanks, everybody, for your attendance. And we look forward to talking to you again soon.
If you have more questions and you're part of the AccuGraph user group, be sure you head over there, and I'll continue answering questions over there. Also, if you're not part of the AccuGraph 5 user group, then feel free to email me personally, Kimberly, Kimberly, at AccuGraph.com, and I will get your emails. Thank you.
Thanks, everybody. Bye-bye.